The capital of Guatemala is the most populated metropolis in Central America. Millions of people going about their lives and representing the engine of a self-sustaining city in search of progress and development. But like any developing city, Guatemala is not exempt from major systemic problems: insecurity, lack of access to decent housing, education, and transportation, poverty, and above all, a dilapidated healthcare system. This decline in the health system is indisputable, but sadly goes unnoticed by the state and an endless list of governments that only neglect it. Humanity First USA established HF Healthcare, which began as a pilot project in Guatemala as a springboard to meet the healthcare needs of other places in the future, as is the case of the construction of a hospital in the Ivory Coast. In June 2016, investment was made on an area of land and construction of high-quality buildings followed, including that of the Nasser Hospital. In 2018, after 2 years of fundraising for its construction, final preparations for its inauguration began, and Nasser Hospital finally opened its doors, not only to the community and its surroundings, but also to people arriving from other Central American countries. Until now, it has provided medical care, social work, and financial aid to more than 48,000 patients.
Recuerdo que durante el año 2018, en sus inicios, pues únicamente iniciamos con nuestro servicio de emergencia, encamamiento y con 4 especialidades básicas. También formamos parte de grandes programas como el programa de trasplante renal, que personalmente me enorgullece mucho, en un programa que prácticamente en un país como el nuestro es escaso.
Doña María Florinda es una pacientita muy querida aquí por nosotros en el Hospital Nasir. Ella entró por un problema cardíaco, una descompensación hidroelectrolítica. Ha estado aquí con nosotros los últimos 2 días en encamamiento, en observación continua por el personal de enfermería, personal médico y personal médico especialista, ¿verdad? Actualmente doña María se siente un poco mejor, ella está mucho más compensada, seguimos tratándola por su descompensación hidroelectrolítica y pues agradecidos de que nos escogió, ¿verdad? Nos sentimos felices de que se siente un poco mejor.
But to keep healthcare services afloat, it is necessary to have financial support that guarantees care for patients with limited resources. Having broader financial support would allow Nasir Hospital not only to continue caring for patients and transforming lives, but also to expand its infrastructure. On November the 21st, 2022, the initiative for the second phase of this project for Guatemala and Central America was presented at a launch ceremony by HF Healthcare.
Next 5-year plan includes Sustainable Healthcare Initiative, which means tailored and advanced medical treatment. This will include CT scan, MRI, mammography, and level 4 lab. This high-tech diagnostic center will be coupled with the 100-seat auditorium for international medical conferences and other training sessions. Rural areas lack good and reasonable healthcare facilities due to the fact that many physicians, they cluster around more populated urban areas. HF Healthcare wishes to extend their health delivery system through mobile clinics through these underprivileged areas. A state-of-the-art diagnostic center and increase in inpatient capacity will help us increase our services to a wider population. Investing in data and research center through innovative applications will help in formulating our plans and programs and achieve our strategic goals in the long term. All these 5 segments or 5-pronged sustainable healthcare initiative fits into the futuristic business model of HF Healthcare, which is focused on providing affordable and quality health to all the underprivileged communities in the world. As we get ready to the biggest challenge of 21st century, that is healthcare.
By supporting this initiative and the self-sustaining humanitarian project of Nasir Hospital, you collaborate directly with the dreams and hopes of thousands of low-income patients who do not have access to a dignified public healthcare system in the region, but who place their trust and life in us.